So tell me about your approach and your philosophy with facelifting. You say you can do a facelift in about an hour.
Yeah. So basically, my approach is, the first thing, people want a facelift, and what do they really want? They want to look younger, they want to have no downtime, and no pain.
Okay.
That's pretty much what they want. They want to go, and a lot of them have felt, people have told them that they're looking tired, looking older, and they feel it when they look in the mirror. They look at themselves and go, wow, I don't look like I feel. So in order to do that, you want to have minimal surgery, minimal cutting, minimum swelling, minimal bruising, okay? And you want natural looking results. So in order to do that, you need to understand what happens as we age in the face first. So as we age, two things happen. We lose volume, okay? Our fat starts to thin, okay? And gravity starts pulling down on everything. And so to do a good facelift, naturally, you need to fix both those problems. Put a little bit of volume back in, and then do lifting. If you just lift only, then you're going to over-pull it, okay, because you haven't replaced the volume. And if you just put volume, then you're going to have a really fat face. Fat
All right.
So now I combine a lot of my facelifts with fat grafting, okay? So again, as we age, brow drops, fullness in the upper eye. Cheek drops, deep fold here, jowl here, loose neck. These are all the things that people come in with. A little hollowing under the eyelid as the cheek fat drops. So what do? We take some fat, we inject fat back into some of these little folds.
Their own fat?
Their own fat.
Okay.
Suck it out from somewhere else, we process it, take the living healthy fat, inject it back in the folds, inject a bit into the cheeks, get a little bit of fullness back up, which in itself, that little volume starts to lift. So you don't have to do as much lifting.
Okay.
Then after that, we then go back in, open the skin up, we then lift the cheek fat pad back up, okay? We lift and tighten the muscles in the neck a little bit. And we take that skin that's lifted and we lift up, not out, up. And because that's what happens. Gravity's pulling down. It's not doing this. It's not pulling you in. It's actually pulling down. So we want to lift up. That creates that natural, unartificial, not that wind-swept pull look. You do this, you're pulling out. So we pull up, okay? With that lifting up, we then now have addressed the jawline, create a smooth jawline with no jowl. We tighten the neck. We get everybody to a 90-degree neck, like a 90-degree angle, okay? We get rid of any folding that happens here between the corner of the mouth and down, because the whole cheek fat pad comes up, and that gets rid of that. We soften this fold here. We never get rid of it completely, because even children have this fold, okay?
All right.
It has to be just softer. It can't be completely gotten rid of. Then we get rid of all the little fine wrinkles in this area, okay?
How?
By lifting that little extra skin out and tightening it up, plus a little bit of filling. So a little bit of pull, a little bit of fill together. That combination means less of each. So it's not over-pulled, it's not over-filled, which is all more natural. And that also means less cutting. Okay, the more I'm filling, the less I have to undermine and cut. So then there's less swelling, less bruising, less bleeding. I also typically use a glue. Okay, so it's not actually glue, it's called fibrin. It actually comes out of our own bloodstream. It's what clots our blood. And we spray that underneath the skin and stick it down. And that prevents swelling, it prevents bruising. And it actually sticks the entire skin down, so there's no tension on the edge of the incision. So the incision has virtually no tension, and therefore heals essentially scarlessly. So then we could take a woman who's in her 50s or 60s, because usually in the 50s is when people want to start doing this, and we can make them look like they're in their 30s, or sometimes even in their 20s if we really want to go that far.
Okay.
Usually, over there you have to do face and eyes and a little bit of forehead too, but that can all be done. And we can really turn that clock back. And I tell people, you will keep aging, so after we're done surgery, you'll continue to age. But if we turned it back 20 years, it's going to take you 20 years to kind of get to where you are again. And you would have been 20 years older. So we kind of permanently turn back the clock.
So do women do people want to look different, or they want to look younger?
They want to look. They want to look. They don't want to. Most people don't want to look different. They want to look like what they used to look like, younger and better. And they bring photos of themselves from when they're 20 or 30 years old. And they say, "Look, this is what I used to look like. Look at me now," right? They'd love to go look like what they used to look like when they're 20 or 30. So they want to look better. That's really what they want, and we can create that. And they don't want to look artificial. That's
so
a huge
natural
thing.
results.
Yeah, the big fear for people on facelifts is I'm going to look like artificial.
Or done.
Yeah, and I was going to say like Burt Reynolds or Joan Rivers or that whole pulled look, but I don't know if I should say that to you. But But I mean, that's what people don't want. I can't tell you how many people come in and say, I don't want to look like Joan Rivers. I don't want to look like Burt Reynolds. I don't want that fake, pulled look. That's a huge fear for them in doing facelifts. And once they start to see how natural they can look and how there really was little to no downtime. And we teach them how to hide it from their friends too. Like just by changing their hair color or their hairstyle or put glasses, people automatically know they look way better and way younger, but they're not going to know why when they see that their hair is red or something. They go, wow, your hair looks amazing. Their brain attributes it to that. So we even help educate them on how to hide and mask this thing. So if you look at this woman on her pre-op photos, she looks like she's in her 60s, and in her post, she looks years and years younger.
Yeah.